Hello, Professor Bafalakos. My name is Adriana Gillespie, and today I will be presenting my soap note for week 6, adult psych. And for today, I had a patient born in 5/15, 1984. He was a 41 Caucasian male who presented to the clinic alone, and he was a reliable historian. The patient's chief complaint was, I feel I'm always worrying about everything. I can't stop thinking something bad is going to happen. The patient, quick HPI. The patient came in with increased worry, insomnia, restlessness, and muscle tension for the last 6 months. These symptoms began shortly after the death of his 13-year-old son, and 8 months ago, who passed 8 months ago. He reported constant worry about the safety of his other son, younger son, and finances, work. He recognized his anxiety was getting worse, and additionally, in the last 3 months or so, he has experienced persistent difficulty falling asleep and staying asleep. He denies any panic attacks, suicidal or homicidal ideations, or hallucinations. He denies feeling depressed. In the past, he reports exercise has helped with anxiety. However, he feels like he's tired and busy, so he hasn't been able to do that. And he denies any other symptoms, and there is no other medical concerns. His past medical history was GERD, and he was taking something for that. And allergies were not related to anything. Family history, it was unknown. He said he does not speak to his family and does not know anything about dad or mom, any chronic illnesses. And social history, the important relevant of these, he drinks 1 to 2 coffees a day. He does drink alcohol once or twice a month. Denies any tobacco or illicit drug use, and he reports his stress is moderate to severe stress right now, with the inability to go to sleep. Okay, review of systems. He reports having anxiety and restlessness, poor concentration, sleeps, disturbances, excessive worry and physical tension, neck tension, but he denies what I previously stated. Vital signs were within normal limits, and upon physical assessment, the patient did seem tired, tense, anxious demeanor. Cardiovascular and respiratory neurological were all normal. Psychiatric, he was alert and oriented, but he did not have maintained good eye contact throughout the whole interview. The patient was really memorable to me. He was a young 41-year-old, around my age, and I have children, and around the age of his son. This patient, it was really memorable because I made sure to make an environment where he felt comfortable sharing what was happening. I have learned now that there is a reason why anxiety or depression or all those things happen, and I really made myself put myself in his shoes when he told me about his son that had passed, and I paused and I made sure to say how very sorry I am for what had happened to his son, and how hard it must be to live with this. And it was very sincere from my part. It was nothing that I rehearsed. I truly felt his pain for just a bit of what he's going through, and it was a change of atmosphere immediately. I felt that the patient just he put his guard down, and he told me that he was really struggling, with the symptoms, and he needed some help. And before anything else would happen, and felt worse, and he wasn't able to work. So I felt that I was able to. I printed this because I wanted to say that in concurring with the Gene Watson 10 character factors, I was able to utilize the fostering and helping trust relationship by actively listening to my patient's concern, which also demonstrated authentic care. and allowed the patient to know that I care for his overall well-being. Some of the resources that I use included when I step out of the room, I research clinical practice guidelines from the American Family Physician on generalized anxiety disorder, and which recommends using a GAD-7 screening, which the patient did take and scored a 17, I believe, and ultimately helped me diagnose the patient and know how to treat the patient. And I felt that the first diagnosis was going to be generalized anxiety disorder. This diagnosis is the most appropriate for my patient who presented with all those symptoms that I previously stated. And the DSM-5 says that this diagnosis can cause significant stress, distress, and impairment, which will display some somatic symptoms like the ones that the patient presented with. Another diagnosis would be major depressive disorder, and which anxiety and depression usually go together. He did say that he didn't have any symptoms of depression, but that's something that could be further investigated. Getting to know the patient a little more, he may be able to open up. Another would be prolonged grief disorder. This diagnosis can also be attached to the loss of the son that he is definitely affecting him. And he did decline to do the PTSD 5. He did not feel like he had post-traumatic stress disorder. For the treatment, the American Family Physician recommends that SSRI could be used, so sertraline 25 milligrams orally daily was prescribed for the first 2 weeks, and then the patient was asked to titrate it to 50 milligrams after the first week. After the first 2 weeks, and then there was one refill done. And this is monitored GI upset because the patient that suffered from GERD, anxiety exacerbation in early weeks, and I did recommend the patient to take the pill with meals or at bedtime to decrease the side effects. Considering psychotherapy is also a great thing that the American Family Physicians recommend. This could be used in combination with the medication. We could refer the patient to CBT to focus on anxiety and the grief processing, and encourage the patient to attend grief counseling and support groups if that was something that we recommended. The patient did not want to do that, but that was something that we definitely expressed those that would be helpful for him. The education that was provided, we encouraged the sleep hygiene education, like establishing a bedtime routine, decreased screen use, or limiting caffeine use. We encourage relaxation strategies like guided breathing or yoga that have been shown to help. Reinforce lifestyle modification like exercise, like he previously stated, was helping. And I did tell the patient that we need to prioritize ourselves to take some time during this day to exercise, as he knew that was something that was helping him before. And the patient was really receptive of that teaching, and he said that he would. Healthier diet, decrease alcohol intake and caffeine use. Mindful based practices have shown to help manage anxiety, and all those things that will help him be able to decrease the anxiety and have a better quality of life. The patient is supposed to follow up in 4 weeks to safeguard that the new medication is helping him, as we know that there's some side effects that could happen. We did go through the side effects that maybe could increase suicidal ideations, and the patient needed to be aware of that, to speak with his wife, and be able to know that how important it is to communicate any kinds of side effects. And the patient will continue to track GAD-7 with every visit, and if anything worsens, becomes more complex, a referral for psychiatry can be considered, as well as the patient always can go to the ER if anything worsens. Okay, thank you so much.